Hi everyone, I'm still here. So my name is Michelle. This is my channel where I document my journey with stage 4 triple negative breast cancer and adrenal insufficiency, which I got from the immunotherapy when I was stage 3 cancer. My most recent previous video there was on Monday the 23rd, where I had been in the hospital for 8 days fighting an infection in my abdomen, in the skin actually of my abdomen. So it is now we're coming to the end of the 11th day here, still dealing with this infection. I had thought that things were on the mend. It seemed like everything was going in the right direction, and the blood work was looking good. The pain was feeling better. Seemed like everything was kind of shrinking. The area that was infected the redness had really gotten better, shrunk down, and everything looked good on Monday night. But then on Tuesday, things started to look not so good again. The white blood cells came up again. The pain started to return over the course of Tuesday and Wednesday. And by Wednesday morning, it was like almost as bad as when I had come into the ER. And so we repeated the ultrasound that I had sometime in the beginning of this stay that showed that there was an area of infection, but nothing big enough that they could really drain. And so really couldn't do anything except antibiotics all week. And because they didn't know what it was, I had to stay here because they were using broad spectrum IV antibiotics, and actually we still are. So what's going on now, though, is on the new ultrasound from Wednesday, they did see that there was something. It was actually Tuesday night at like 11:30 at night that they did this. They decided Tuesday, when things started to get worse again, to just repeat that ultrasound. So Tuesday night, we did the ultrasound. Wednesday morning, the surgeons looked at it again and said that they have a pocket big enough that they could drain, and they did that on Wednesday, which was yesterday. Today's Thursday now, the 26th. And yesterday when they did the drain, for me anyway, I definitely felt better. The pressure of the pain of that abscess kind of consolidating there was pretty significant. Whereas I was walking around the floor here, 5 times a day. Well, actually a couple times a day. And then I couldn't do that anymore because it hurt so bad to move. So based on the pain and the fact that my white blood cells were still doing the cha-cha, so they had come down at my last update, but then they went back up again, and then they came down again. And they've been coming down all 3 days, though. We had 3 downtrends in a row, so they're pretty happy that the antibiotics are correct. I did want to interject here. They do think that the doctors all kind of agree that maybe the high doses of steroids that I had been on, managing the adrenal insufficiency, giving my body what we thought it needed to fight this infection. But at some point, the infection came down enough that we could have come down on the steroids, but we didn't, because I had those few events in the beginning where I needed more. So the doctors kind of just kept me at that. It was 50 milligrams IV hydrocortisone every 6 hours. And at some point, my body didn't need that much anymore. And so having such a high dose of steroids actually affected the white blood cell count and made it go up. So that didn't mean that the infection was necessarily getting worse. It stayed local, but we needed to wait for it to evolve into something that they could then intervene with surgically. So steroids likely affected the white blood cells, but because the white blood cells were going up, they couldn't take the chance to send me home, or to take me up. Well, I wouldn't have gone home anyway. Once the pain started getting worse again, as it started to consolidate, then I wasn't going to go home anyway. But that was I did want to just interject that the steroids, adrenal insufficiency is really a difficult thing to navigate. You have to have enough steroids for your body to fight the infection and mitigate the side effects of all the medicines that you're throwing at it. Like, all of this is stress on the body, and the pain of this thing kind of growing. It's like an alien that needs steroids, additional steroids from my baseline. But what we did, it was Tuesday night actually that we first switched to oral steroids and started to taper down the evening dose. And then the next day we did, I'll do a whole video just on the steroid management, but we started to come down on some of those doses. And I think that helped the white blood cells start to really kind of normalize to where they really would be anyway. So I just wanted to put that in here. And the abscess is now drained. Today they actually put a drain in so that it won't close up, because when the surgeons looked at the drain, what they did yesterday, this morning, they were concerned that it was just going to close and do the same thing again, because we still don't know what it is. They did send it for a culture, but we don't have those results yet. So, but it's draining. It's got a drain in it, and infectious disease is happy with the drain that's placed. That will clear the infection from the skin out. The antibiotics will work internally on anything that's there, and he's comfortable switching me to a broad spectrum but an oral antibiotic to go home tomorrow, as long as nothing changes overnight. So that is my update for now. Just that. It looks like I'm going home tomorrow, fingers crossed. I'm still on IV antibiotics tonight. I'll probably get the last IV infusion about 2 a.m. And yeah, that's pretty much it. I have a lot of funny stories from the last, well, when I get out tomorrow, it'll be 12-day hospital stay. Lots of funny stories and a couple not so funny ones, but we'll talk about those individually, because to tell the whole story all together, we'd be here for a whole movie. Lots of stories coming your way when I'm sitting home recovering. I'll make some funny videos and some serious videos, but for now, I'm signing off. I hope to come home tomorrow, and thank you to everyone who has donated to the GoFundMe that I post. It's Amazon wish list. Like, just thank you so much for everyone who's supporting. Even just the prayers are so appreciated, and I hope to see you again in a video soon. Everybody have a lovely night and a wonderful weekend, and I hope the sun is out so I actually get to get some sun, because I've been in these four walls. That's my window over there. That's my sink over there. I'll just turn this around. There's my door. That's a closet and a bathroom and a shower stall, and back around to me. That's my, it's not really four walls. It's a weird shaped room, but it's comfortable, it's cozy, it's quiet. The bed is actually really comfortable because I find just the right position, and yeah. Good night.